All right, so next skill is CPAP. This is new this year for all EMTs to be tested on. What we're going to do is we're going to have the standard traditional application of the CPAP, but the one thing I want you guys to focus on is your indications and contraindications. Okay, so just to read them off so you guys remember them. Indications are going to be pulmonary edema, COPD, exacerbation of neuromuscular disease, such as superimposed pneumonia, acute respiratory failure, so hypoxia less than 88%, hypercarbia, so CO2 greater than 45 above baseline levels, increased respiratory rate with an inadequate tidal volume, tripoding, air hunger, diaphoresis, grasping, and significant accessory muscle use. Contraindications are going to be facial deformities, apnea or decreased respiratory rate, inability to follow commands, acute chest injury or pneumothorax, active vomiting or upper GI bleed, and precautions are facial hair, and be really precautious on hypotensive patients. Okay, so far as CPAP, we're going to start with having the patient sitting upright. They're going to be breathing on their own. The first thing that we need to put on is we need to put on the capnography cannula. So that needs to go on first. So we don't want to take off that CPAP later to put this on. So we're going to slide it into the patient's nose. Make sure you're talking to your patient, advising them what you're doing. They might have a little tickle or a weird smell. Go ahead and get your baseline capnography reading. So hook that up to the monitor and get your baseline, let it set. We can go ahead and start assembling our mask together. So we're going to put this blue port is going to go down. So we're going to assemble that into the down position. Make sure this is down to 5. You can go all the way up to 10 per standing order, but we're going to maintain it at 5. And in case you forget, this goes on 10 liters per minute of oxygen. There's a little sticker on the end of the label that actually will tell you in case you forget about it. We're going to coach the patient. You can either have the patient take the mask and apply it to themselves, or you can coach the patient and slowly ease it towards the patient's face. Once the patient becomes more and more comfortable, you can get closer and closer to the point that you actually formulate a seal. Once we have a seal, we're going to wait here for a minute or two until the patient is comfortable with the mask. Then we're going to tell the patient we're going to apply the head strap. So lift the head strap up and over. When you're doing this skill, you can have a partner help you, because it is kind of difficult to strap this thing around. Make sure you loosen the straps first. There you go. There we are. Go ahead and tighten your bottom strap. And then tighten your top strap. Make sure that is snug up against the patient's forehead and adjust as necessary, and tighten this as necessary. Reevaluate your patient, check for breath sounds, recheck your capnography, and if you need to give a breathing treatment, this just plugs straight into the bottom at your normal 6 to 8 liters per minute, and that will give the breathing treatment through the CPAP device.